So the Health Leadership Academy gave us some funding to investigate medical student experiences of mistreatment and abuse and the experience of resident physicians who have graduated from the medical program. They have their MD, but they're not independent practitioners. They're still trainees. What we were interested in understanding was how medical students and residents might experience mistreatment and abuse in their clinical training, how they make sense of those experiences, so how they decide whether the behavior that they've encountered is really mistreatment or is it just rudeness or some unproductive behavior that they need to tolerate and accept as part of the medical training environment.
My name is Dr. Amanda Bell. I'm the Regional Assistant Dean at the Niagara campus of the Michael G. DeGroote School of Medicine at McMaster University. I'm very fortunate to be part of this project that involves senior leadership from all three campuses of the medical school at McMaster, as well as education scientists from Merit, members of the Program for Faculty Development, as well as faculty members from the DeGroote School of Business. This is really a unique opportunity in that we have collaborated across campuses, across faculties, across programs to really come together to understand this problem at a deeper level and work towards meaningful change with the engagement of leadership from all departments.
So one example is the way that questions are used in the clinical environment. So sometimes people call this pimping, which is an acronym for put in my place. So sometimes in the medical environment, supervisors or preceptors will ask a series of increasingly difficult questions to a learner, maybe in front of a group of other learners or patient or the other clinical team, or it might just be a one-on-one situation. And depending on the content of the questions, the relevance of the questions to the clinical care that they're delivering together, and the preceptor's response when the student fails to answer a question correctly, doesn't know an answer, offers an incorrect answer, sometimes these scenarios can be perceived as abusive, especially when they occur in front of a group and where the student feels like the intent of the questions is to humiliate them, to highlight a gap in their knowledge, or to make them feel inadequate or insufficient in their learning. So I think that the investment from the Health Leadership Academy is a really important gesture of institutional support for this topic. At McMaster, we're very keen on improving the student experience, and I think the support from HLA, the support from the leaders within the medical school itself is an important marker that we want to acknowledge that medical student mistreatment happens, and it happens here just like it happens at all of the other medical education institutions, but that at McMaster we're interested in improving that experience of students and improving our learning environment.